In this lesson, we're going to cover drinks you should steer clear of if you have an enlarged prostate. Many of the beverages we'll discuss have been linked to worsening prostate symptoms or increasing the likelihood of developing prostate cancer. I'll explain how each one impacts prostate health and why it's best to avoid them. So the first category of beverages we're going to talk about in this lesson is alcohol. So alcohol is one category of beverages to avoid if you have an enlarged prostate because alcohol acts as a diuretic, meaning that it increases urination or frequency of urination. And it does this by inhibiting the release of antidiuretic hormone, also known as vasopressin. So this is the reason why alcohol causes diuresis. So because of this, it increases frequency and volume of urination. And because it increases frequency and volume of urination, it's going to increase and exacerbate the symptoms of benign prostatic hyperplasia, or BPH, which is also the medical term for an enlarged prostate. So best to avoid alcohol, and drinks that contain alcohol are what you want to avoid, including beer, wine and spirits, along with other alcoholic beverages. So again, best to avoid alcohol if you want to reduce symptoms of benign prostatic hyperplasia or an enlarged prostate, because alcohol acts as a diuretic, increasing frequency and volume of urination. So it's going to increase those symptoms of an enlarged prostate like urgency and nocturnal urination or nocturia. So best to avoid alcohol. So one category of beverages that is best to avoid if you have an enlarged prostate is caffeine, because caffeine also acts as diuretic. So for similar reasons to why we want to avoid alcohol, caffeine acts as a diuretic. So you want to avoid it because it increases urination, including frequency and volume, which can exacerbate symptoms of an enlarged prostate or BPH. So you want to avoid drinks like coffee, tea and soda pop. So again, caffeine, you want to avoid it because it is a diuretic. It increases urination, increases frequency and volume of urination. It's going to increase the likelihood of having lower urinary tract symptoms that are associated with a large prostate. And drinks that contain caffeine include caffeinated coffee, tea, and soda pop. Dairy products are worth limiting because high intake may be linked to an increased risk of prostate cancer. Some research indicates that consuming large amounts of dairy can alter gut bacteria in a way that could contribute to this risk. This association is highlighted in a study titled Dairy Product Consumption and Prostate Cancer Risk in the United States. Therefore, it's advisable to reduce or avoid beverages containing dairy, such as milk, cream, and milk-based shakes. To lower potential risk, cutting back on dairy products, especially in beverage form, is recommended. Another group of beverages to steer clear of if you have an enlarged prostate are carbonated drinks. This is because carbonated beverages are known to irritate the bladder, which can worsen the symptoms of benign prostatic hyperplasia, or BPH, or an enlarged prostate. Bladder irritation can lead to increased urinary frequency, urgency, nighttime urination, nocturia, and difficulty starting urination. These symptoms are often aggravated by carbonated drinks such as soda, club soda, and other sparkling beverages. Therefore, it's best to avoid or at least limit carbonated drinks, as they may contribute to worsening urinary symptoms by irritating the bladder. Another category of beverages to consider avoiding if you have an enlarged prostate is certain fruit juices, specifically acidic ones. These include juices like orange, lemon, and grapefruit. The concern is that acidic juices can irritate the bladder, which, as mentioned earlier, may worsen symptoms of an enlarged prostate, such as increased urgency and frequency of urination. However, it's important to note that the research on this topic is somewhat mixed. While acidic fruit juices may trigger or worsen symptoms for some individuals, studies have also suggested that juices like orange juice might help improve lower urinary tract symptoms. This is partly due to their high vitamin C content, which may support prostate health. Because the evidence isn't definitive, it may be helpful to monitor how your body responds. If you notice your symptoms get worse after consuming acidic juices, it could be worthwhile to reduce or eliminate them from your diet and see if your symptoms improve. Overall, while acidic fruit juices might aggravate prostate symptoms for some, they could also have potential benefits for others. This was the first video on the channel. Take care of your health and stay tuned for the next episodes.